Hello everyone, how are you today? Welcome to my channel. I am Dr. Paramjeet and you're watching Dr.Education. And as you know, I make health and healthcare videos. I give you simplified and very authentic information about why you get sick and how you can get better. So today we are going to talk about ovarian cyst or functional cysts. So we are going to talk about the cyst which you can form in your ovaries during your regular monthly menstrual cycle as a female. And any cyst is a sac filled with fluid. When it forms inside your ovary, it's an ovarian cyst. So today we are going to talk about the causes of these cysts, the symptoms which are involved, the tests and examinations which are used to diagnose the problem, and the treatment of this cyst in a very simplified language. Also, we will include the possible complications and the prognosis of this condition. So that's all we are going to cover in this video today. So stay connected guys, and make sure you have subscribed the channel and hit the bell icon. All the information given here in this video is directly referenced from internationally accepted US National Medical Library, so you can trust the information. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Each month during your regular menstrual cycle, a follicle grows on your ovary, and this follicle is where the egg develops. Most months an egg is released from this follicle. That is what is called as ovulation. And if this follicle fails to break open and release the egg, then what happens? The fluid stays inside the follicles and the follicle just grows and forms a cyst. This is called a follicular cyst or sometimes an ovarian cyst. Another type of cyst can occur even after the egg has been released from the follicle, and this is called a corpus luteum cyst. This type of cyst often contains small amount of blood as well. So ovarian cysts are very common in childbearing years between the puberty and menopause, and the condition is very less common after menopause. Then taking fertility drugs can cause a condition in which multiple large cysts are formed on the ovary. This is called as ovarian hyperstimulation syndrome, and the cysts most often go away after the woman's period or after pregnancy. So functional cysts, functional ovarian cysts are not the same as ovarian tumors or cysts due to hormone related conditions like polycystic ovarian syndrome. No, they are different. Functional ovarian cysts are not PCOS, are not ovarian tumors. Alright. Let's talk a little about the symptoms and then we'll come to the diagnosis, how we diagnose that. Many times ovarian cysts, functional cysts cause no symptom at all, but sometimes it may cause pain. Pain will happen only if it becomes very large, if it starts to bleed, if it breaks open, or if it interferes with the blood supply to the ovary, or if it is bumped during sexual intercourse, or if it is twisted or causing a torsion, twisting of the fallopian tube. So all these things can lead to pain. Apart from pain, other symptoms can happen because of ovarian cyst. There can be swelling in the abdomen, there can be bloating, you can have pain during bowel movement, during passing your feces. You can have a pain in the pelvic area shortly after or beginning of a menstrual period. You can have pain with intercourse or pelvic pain during movements. This pelvic pain can be constant or sometimes it can be dull, aching and intermittent also. Sudden and severe pelvic pain, often with nausea and vomiting, may be a sign of torsion or twisting of the ovaries on its blood supply and or a sign of rupture of the cyst or internal bleeding. So it should be taken very seriously and should be tested. Then changes in the menstrual period, menstrual cycle patterns are not common with follicular cysts and are more commonly due to corpus luteum cysts. Spotting or bleeding can happen spotting or bleeding may occur with some types of cysts. So how can you diagnose them? Your doctor may discover a cyst during your pelvic abdominal exams or even when they do an ultrasound. Sometimes a functional cyst is an incidental finding in your routine ultrasound for some other reason, and your doctor might want to repeat the ultrasound after 6 to 8 weeks again to make sure it's gone, because most follicular cysts go away after your next period, like after a month or 2. So that's why your doctor might repeat your ultrasound after 6 to 8 weeks. Other imaging tests may be done only when they are needed, including CT scan, Doppler flow studies to check the blood flow to the ovaries. Sometimes MRI can be done. Sometimes, very rarely, only when we suspect any other reasons of cancers or something else, we can do blood tests like pregnancy test, serum HCG, hormonal tests, serum estradiol, testosterone, FSH, LH test. Then sometimes CA125 test can also be done to look for possible cancer if you have an abnormal ultrasound or if you are past menopause. So what is the treatment? Functional ovarian cysts do not need any treatment. Often do not need. They often go away on their own within 8 to 12 weeks. But if you have frequent cysts and major symptoms, your provider may prescribe birth control pills, oral contraceptive pills. These medicines reduce the risk of developing new ovarian cysts, and birth control pills do not decrease the size of the current cysts. They will just reduce the risk of developing new cysts. Sometimes when the cyst is complicated, when it is having torsion, or if the blood supply or if it has ruptured or the pain is too much, surgery is needed to remove the cyst, or sometimes the ovary may need it to be removed to make sure that it's not ovarian cancer. Surgery is more likely needed for a complex ovarian cyst that do not go away, a cyst that is causing major symptoms that do not go away, a simple ovarian cyst if it is larger than 10 centimeter size, or if a woman who are near menopause or past menopause who is having an ovarian cyst. In that case, you are not expecting any other function from the ovary, so you can easily take out one ovary, which is causing problems. So what are the types of surgeries which you can do in ovarian cyst? That includes surgery can be done by opening your abdomen, exploratory laparotomy, and laparoscopically surgery also can be done, pelvic laparoscopy, to remove the cyst or the ovary. You may need other treatments if you have a polycystic ovarian syndrome or other disorder causing the cyst, but in ovarian follicular cyst, other treatments are not needed except for contraceptive pills or surgery. Cysts in women who are still having periods are more likely to go away. So the prognosis is very good. A complex cyst only in women who has passed menopause has the higher risk of being cancer, or else cancer is very unlikely with a simple cyst. What can be the complications with a normal functional cyst? Like I said, they can bleed, they can break open, they can show signs and changes which could be cancer, they can twist, and depending upon the size, they can get bigger and bigger, causing higher risk. So that's all which you need to know. And there are some signs which we already discussed, on which you could go to the ER if the pain is very severe, if you have a very severe symptom, bleeding, if you have vaginal bleeding which is not normal for you. You may even contact your doctor if you're not feeling like eating, if you lost your appetite for more than 2 weeks, if you're losing your weight without trying, if you're getting full, even if you're getting full quickly when eating. So all these signs are there for which you should consult a doctor. Then is there anything which you can do to prevent functional ovarian cyst? If you're not trying to get pregnant, and if you are getting these cysts, you can prevent them by taking hormonal drugs like oral contraceptive pills, birth control pills. These medicines prevent the follicles from growing, so therefore physiological ovarian functional cysts are also prevented. So that's all guys about functional ovarian cyst. That is different from PCOS or a cancerous or a benign cyst. Don't confuse them. There is a different video on PCOS, polycystic ovarian disease, and you can check that out on my channel. And there are many more videos for you to see. All are referenced from the US National Medical Library. All have authentic knowledge in simplified language. Those who don't know me, I am Dr. Paramjeet, a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and I make videos on an almost daily basis. So don't forget to subscribe and hit the bell icon and share these videos to all your female friends. So that's all for today guys. Till next time, keep watching my videos, stay connected, stay healthy.